isn't about restrictions, it's about adding vitality to our years. In every episode, we sit down with top experts and everyday people to help us learn practical yet science-backed strategies useful to become healthful.
Our show provides essential information, medical breakthroughs, disease prevention, and wellness trends. These headlines help people make informed daily choices.
I'm Pier Pastor. Hosting with me is Doc Rodnie Valerio from the Bello Nexa of the Bello Medical Group.
Wellness is wealth.
About 9% of Filipinos have some form of thyroid disease and is more common in adult women, particularly during pregnancy, after childbirth, or during menopause. Elderly individuals are also at higher risk. These include goiter, hypothyroidism, hyperthyroidism, thyroid malignancies or thyroid cancer, and other iodine deficiency disorders. But goiter remains the most common thyroid disorder with a prevalence rate of 10.12%. Despite these efforts, thyroid disorders remain common factors such as poor diet, limited access to healthcare, lack of awareness, family history, and stress contribute to the continued rise of thyroid problems.
Iodine deficiency continues to be a contributing factor to thyroid problems in the country. The expanded National Nutrition Survey found that only 33.2% of Filipino households adequately consume iodized salt. The Philippines has made significant efforts to address thyroid disorders, especially those linked to iodine deficiency.
But despite these efforts, thyroid disorders remain common. Factors such as poor diet, limited access to healthcare, lack of awareness, family history, and stress contributes to the continued rise of thyroid problems.
Namayat ng husto at parang nagmamadali palagi. These were among the first symptoms ni Llewellyn Tolentino. Pero ang ikinabahala niya ay ang naranasan niyang tremors o panginginig. Hyperthyroidism ang naging diagnosis matapos ng ilang test.
Nag-start kasi ako having, palpitations, tapos nag-decrease yung weight ko. No matter how much I eat, talagang nababawasan. Bumaksak din kasi yung weight ko, kaya ang immune system ko, bumaksak din siya. So I had to go to the doctor kasi on and off yung fever ko, lagi ako may sakit. So sabi ng doctor ko, when I went there, sabi niya, bakit ganun? Ang bilis ng heartbeat mo, nasa 100 plus, kahit at rest ako.
Pero ang mga gamot ni Llewellyn sa hyperthyroidism gave her another problem.
Unfortunately, lahat ng ibigay nilang gamot sa akin, nagto-turn out na nagkakaroon ako ng allergies.
Kaya't binigyan na siya ng radioactive iodine kung saan kailangan niyang ma-isolate sandali dahil nag-e-emit siya ng radiation na maaring makaapekto sa mga nasa paligid niya. Matapos namang makontrol ang hyperthyroidism ni Llewellyn, ay na-reverse naman ito to hypothyroidism.
Kabaliktaran naman siya ng lahat na nangyari sa akin before, so my pulse is slower, my movements, my speaking abilities is slower. Even yung the way I think, medyo mabagal pagka nagre-react ako.
Ang pinakamahirap na parte ay nakaaapekto sa trabaho ni Llewellyn ang pagbagal ng sistema ng kanyang katawan, dala ng hypothyroidism.
I work in a place na very fast-paced ang mga tao. Tapos ako, bumabagal. Dahil mabagal kang magsalita, wala kang sense of urgency.
At dahil bumagal ang kanyang metabolism, mabilis din ang pagdadagdag ng kanyang timbang.
Just last year, I think that was my heaviest. Nasa 68 kilos that time.
Kailangan niya itong gawan ng paraan dahil marami ding kaakibat na sakit ang pagiging overweight, gaya ng hypertension. Bagaman nakokontrol naman ni Llewellyn ang kanyang timbang, lifetime na ang kanyang hypothyroidism, kaya panghabang buhay na rin ang kanyang medicine. Ayon sa kanyang doktor, kapag hininto ang kanyang pag-inom ng gamot, ay maaring mahirapan ang ibang organs gaya ng puso. No known cause ang hyper at hypothyroidism, sabi ng doktor. Naging sanhi na din ito ng depression ni Llewellyn. But as days went by, she learned to accept her condition.
there are some things that you have no control of. So, this is one of those things that I have na I don't have any control of. Kahit gusto ko mawala, nandyan na siya eh. You just have to live with it and you just have to know what to do to be able to manage your lifestyle.
Sa ngayon, Llewellyn takes good care of herself by religiously taking her meds, eating well, and engaging in exercises para maiwasan ang mga complications at para magawa pa rin niya ang mga gusto gaya ng pagpapatuloy ng kanyang career and traveling.
So, our topic is thyroid, no?
Yes.
And Llewellyn, baliktad yung nangyari sa kanya, extremes. From a hyper, naging hypo. Nakita mo yung change in body niya.
Yes. Pero ang maganda doon, na pagtagumpayan niya sa sarili niya, yung
Yeah,
condition.
she accepted it na, no?
accepted na lifetime na, yung gamutan niya. Yan. To help us understand the importance of our thyroid, joining us this morning is Dr. Robert Michael Gan. Dr. Gan is an endocrinologist from Makati Medical Center. He is also a fellow of the Philippine College of Physicians, the Philippines College of Endocrinology, Diabetes and Metabolism, and the American College of Endocrinology. He was also the past president of the American Association of Clinical Endocrinologists Philippine chapter. He also heads the Endocrinology Transition Clinic at the Makati Medical Center. Good morning, Doc, and welcome to Wellness is Wealth in Billionaire News Channel.
Morning, Doc.
Good morning, Doc.
Good morning, Ms. Pierre. Good morning, Dr. Rodney.
Hello.
Thank you for having me here, and it's a pleasure
Yes,
to
Doc.
be part of the show and share the discussion with everyone.
Yes, because we have lots of questions about our thyroid. But before we dive into the chaotic tug of war between hypo and hyper, we need to understand what the thyroid actually does po. Please give us clear breakdown of the thyroid functions, Doc. Like, paano ba ito nagbibigay sa atin ng energy and temperature natin? Opo.
First, all of us have a thyroid gland. It's located in the anterior neck.
Okay.
And it produces hormones. I know there's several kinds of hormones, like sex hormones, growth hormones, and others, but we'll be talking about thyroid hormones.
Yes, Doc.
And they are responsible for the metabolism of our body.
Okay.
And when we say metabolism, it is the part where the thyroid hormones tell the cells to produce energy, like the quicker breakdown of food if we need the energy right away,
Okay.
and it affects the heart and other organs.
Okay, so you mentioned about the heart, Doc. So, how does it relate to cardiovascular system? Paano po
Yes.
siya nakaka-relate sa cardiovascular natin?
Yes, it directly involves the heart, the blood vessels, and circulation. For example, the thyroid hormones, when they act on the heart, it gives energy, like it increases the heartbeat, and with the fast heartbeat or regular heartbeat, it involves also with the cardiac output, the pumping of the heart. So with that, it also affects the blood pressure.
So, the thyroid hormones affect the activities of the heart also.
Yes.
Correct? And in relation to that, Doc, we also know now na ang thyroid hormones pala are also included sa absorption ng calcium or bone development. Is this true?
Yes, it's correct. Especially for kids, we want them to have a normal thyroid function for normal skeletal growth and bone maturation. So if you, not all, but if they lack hormones, we expect a delay of growth and short stature. While the opposite, if they have too much hormones, we expect fast bone turnover, and then maybe, if you heard of this problem, osteoporosis, the thinning of the
yeah.
bones.
I see.
So, affected din sila even with just the thyroid gland, no?
Yes.
Okay.
Okay.
Nakikita ko,
involves
Dok,
everything.
masalimuot. Masalimuot ang role ni thyroid, no? Marami siyang kailangan gawin sa katawan.
Tsaka the effects are systemic all over, no? Hindi
Yes.
lang siya on a particular organ or
Yeah, not
side.
only the heart, but everything, even the muscles, the brain,
Yeah, the brain also, diba?
digestive
Oo.
system.
Yeah, so a doctor learning the thyroid, talaga, Dok, lahat yan ay pinag-aaralan.
With all doctors, they
Yes,
have to
yes,
study
yes.
everything.
Okay, now, Doc, what happens, Doc, pag nagkakaproblema si thyroid? O ano ba nangyayari kay thyroid gland? Bakit siya nagkakaproblem?
Yes. First of all, what kind of thyroid problem? So I think we'll discuss it later, but generally, autoimmune problem.
Okay.
Autoimmune problem means, auto means self, immune means your immune system. Sometimes you have some antibodies that will attack your a specific organ. The most common autoimmune problem would be, if you heard of SLE, the systemic lupus erythematosus. They have like specific antibodies that will attack the kidneys. Here, if we'll talk about thyroid, we have also thyroid antibodies that attacks the thyroid gland to then give them problems.
Alright. So, pagka, ano na Doc, kahit healthy yung ating, pagka nagka-problema si thyroid, every part of our body will be affected, Doc.
Yes, and then if you'll ask, where does these antibodies would come from? It's genetics, hereditary. We don't know where,
hindi
but
siya
usually
na-foresee, Doc, no? Hindi siya na-predict. Automatic siya nangyayari kasi nga autoimmune.
yes. But if you have a family history, then early checkup can help.
Now, yun, Doc. Pwede palang maranasan, Doc, ang both hyper and hypo ng isang tao.
Yes,
So, katulad nung nangyari kay Llewellyn, yung ating case study. Bakit, Doc, hindi siya, halimbawa, kinokorek na yung kanyang hyper, but hindi na control na maging hypo? Anong nangyari in between?
Probably Llewellyn had thyroiditis at first. Thyroiditis is inflammation of the thyroid gland. Again, by the antibodies, they're attacking the thyroid gland. So the thyroid gland tends to bring out too much hormones at the time.
I see.
So there's as if there's destruction of the thyroid gland. So all the thyroid hormones are coming out, and it presented like hyperthyroidism, what she complained of. Then eventually, maybe she was given treatment, and then with this thyroiditis, usually the profile would be hyperthyroid profile, meaning too much hormones. Then eventually it will be normal. Then with continuous destruction slowly, then will lead to hypothyroid. With Llewellyn, maybe she was having the hyperthyroid phase, and then she was given treatment. So as if it's like accelerated. So instead of normal, she went to hypothyroid.
All right.
Faster,
Now, we will talk more about that, Doc, ang kaibahan ng dalawang yan. But we will have to take a break for a while. Keep it here on Billionaire News Channel. Wellness is wealth.
A new kind of race is taking the European and American fitness scene by storm, and now it's finally here. Put the words hybrid and rockstar together, and you have Hyrox. Dubbed as the World Series of Fitness Racing, Hyrox can be intimidating and intense.
United States and now Asia, fitness enthusiasts are lining up for the world's fastest growing fitness race, including Kylie.
I am an athlete at heart, so working out, all these sports, it's not new to me.
Hyrox is a hybrid fitness race that combines 8 kilometers of running with 8 functional workout stations.
When I heard about Hyrox, I thought, oh, it's just another fad. But then because my friends, my colleagues, they were into it, they got me into it also. And then I got addicted right away.
Coach Dan Hilaria says this rapidly growing sport covers all aspects of fitness, from cardiovascular work to strength training.
Yeah, I think gone are the days wherein people are just running or people are just lifting weights. Now, the season of hybrid fitness has completely dominated the fitness scene. So people of all ages realize that there's a benefit of incorporating strength and endurance in their program or training.
Hyrox was created by Christian Torska and Olympic hockey champion Mortis Forsta in Germany in 2017. The fitness race quickly spread in Europe and the United States, with races in at least 11 countries in over 30 cities worldwide. And now it's taking off in Southeast Asia. Coaches Dan, Luigi, and Kylie break down the race format. The race format,
1 kilometer of running followed by 1 workout station times 8. Now ready? Get set, run. Start with 1 kilometer, then station 1, 1,000 meter ski erg. 1 kilometer run, station 2, 50 meter sled push. 1 kilometer run, station 3, 50 meter sled pull. 1 kilometer run, station 4, 80 meter burpee broad jumps. 1 kilometer run, station 5, 1,000 meter rowing. 1 kilometer run, station 6, 200 meter farmer's carry. 1 kilometer run, station 7, 10, 20 or 30 kilogram sandbag lunges. 1 kilometer run, and finally, station 8, 100 wall balls.
The movements are easy, but the challenge is where, you repeat all the stations with runs in between. That's when it gets challenging. I think there's still a stigma there that people think this is only for pros or athletes. You don't have to be an athlete to start working out and just to start enjoying Hyrox. You can be someone who's just interested in getting fit.
Fitness coaches say, although Hyrox is for all ages and fitness levels, preparation is everything. A balanced meal is a given, but Coach Dan says, fuel up with carbs for energy, hydrate, and never skip warm-up to help prepare your body for the race of your life.
Ayun, grabe. Pero hindi ko yun kaya.
No, but it's very challenging. But at the same time, fulfilling. May mga stations pala
Yes.
to, no?
Oo.
Ang ganda ng mga sports fitness ngayon.
Alright. But kanina napag-usapan na natin na pwede palang magkaroon ng hyper and hypo ang isang tao. Pero Doc, expound natin, ano ba ang kaibahan ng dalawang yan talaga? The difference between hyperthyroidism and hypothyroidism.
Yes, as mentioned earlier, I said about thyroid hormones.
Yes.
Okay.
So, hyperthyroidism means too much hormones, too much thyroid hormones. And the opposite, hypothyroidism means kulang ng thyroid hormones.
Okay. So
lacking
Doc, ano
thyroid.
yung causes ng hyper at causes din ng hypo and what are their symptoms po?
Yes. First, we'll go to the causes of hyperthyroidism. The most common cause would also be, again, autoimmune problem.
Autoimmune, yeah.
The specific antibody would be, if they're interested, TSH receptor antibodies. It attacks the thyroid at that certain part. So there you will have the condition called Graves' disease. Hindi Grabe, but it's just
Great.
Graves by the surname of the founder.
I see.
Okay, so that would cause hyperthyroidism. And other causes would be sometimes the thyroid would have nodules or buccal, and that buccal would be producing the hormones, exaggerated formation of the and release of the hormones. And others would be like infection, which would you have your thyroiditis.
Okay.
Or some medications can also increase the production of the thyroid hormones. For hypothyroidism, what would
Yes.
be the causes? Again, autoimmune problem, but a different antibody. And that would cause destruction of the thyroid gland. And then here you will have, some would hear about this, the Hashimoto's thyroiditis.
Okay.
That is hypothyroidism. And other causes would be surgical removal, since they remove the thyroid gland. Since there's no thyroid gland anymore, no more hormones. So hypothyroidism. And others again, like medications, or even mentioned earlier, like our case with Luella, is thyroiditis.
Alright. Now, Doc, dahil nga bumibilis kapag may hyper ang sistema ng katawan, what are the tendencies po kapag mabilis siya? Ano nangyayari sa atin?
Okay, like before I go into that, the signs and symptoms naman.
Okay, yes.
Signs and symptoms, again, if too much hormones means everything is too fast. Let's say the heart means faster heartbeat, the heart is pounding, patients will complain of palpitations. Digestive system, too fast. So
mapayat.
they are going to the toilet too often, frequent bowel movement.
Even the metabolism.
You mentioned like
Papayat.
payat is the muscle as if they are exercising, even at rest, as if they're exercising. So pumapayat because the metabolism is too fast. And to the brain, they can concentrate too much. And
Anxiety,
others.
Doc.
Okay.
And then anxiety. And then
Okay.
the opposite naman, hypothyroidism. If kulang ng hormones, slower heartbeat, and then slower digestive system, meaning constipated. They complain of that. Even they're exercising, but their metabolism is a bit slow, so they tend to get big, like in our case.
Pag yung sa Doc Hyper, ano sila, mas cold resistant or hindi nila kayang malamig?
Yeah,
O pag
since hyper, more energy, more heat, so heat intolerant.
Heat intolerance.
Pawis
Konting
agad.
pawis, konting galaw, pawis.
So si hypo ginawin.
Yeah,
Ginawin.
opposite naman. ginawin.
I see. Which is dangerous, Doc? I mean, along ang mas mahirap i-manage dyan sa dalawang situation?
Both are dangerous.
Okay.
Both are easy to manage. And then, as long as they see their doctor. So, both are easy naman.
Okay, so I'll ask about naman, Doc, no? Kasi very common for our wellness investors, they know about goiter or sa Tagalog, it's bosyo. So, goiter, I think, if I'm correct, Doc, no, it's not necessarily a thyroid disease. It's a thyroid organ problem. Malaki ang thyroid, but it's not necessarily mali yung balanse ng hyper and hypo. Correct po ba yun?
Yes.
So, let's
Yes.
define what goiter is, and then that's related to hyper and hypo.
Yeah, goiter simply means enlargement of the thyroid gland. Malaki ang thyroid gland. So, I have patients, they have goiter lang. So, eventually, they heard about hyperthyroid or hypo, but their results are normal. So, they will be asking, hey, doctor, what do I have? Hyper or hypo? So the doctor will say, like me, I'll tell them, no, you don't have any of it. You just have a simple goiter, meaning your thyroid gland is enlarged.
Okay, okay.
All right. Now, when we return, we will talk about how thyroid problems are diagnosed. Keep it here on the Billionaire News Channel. Wellness is wealth.
And we're back. Aside from regulating crucial functions like hormone production, heart rate, and body temperature, the thyroid gland's primary function is controlling metabolism, or how your body uses energy. This butterfly-shaped organ is responsible for every calorie burned during physical activity, every drop in body temperature, and even the speed at which your body functions. So you may want to closely monitor what you eat.
The thyroid gland sits at the base of the neck, just in front of the esophagus where food passes. When enlarged, swallowing can become difficult. The impairment of swallowing, a condition also known as dysphagia, can make eating or drinking excruciating. So while you can still eat normally and before swallowing difficulties set in, a nutritionist or dietitian can help manage those thyroid issues. Experts say what we eat or not eat plays a vital role in supporting thyroid health. In 2024, the University of Parma and University of Moderna in Reggio Emilia in Italy conducted a narrative review on the role of nutrition on thyroid function. Part of its conclusion states that iodine, which can be found in seafoods, seaweeds, and dairy, is beneficial for thyroid disorder prevention. With careful monitoring, selenium, which can be found in Brazil nuts and eggs, may reduce thyroid autoantibodies and improve thyroid function. Vitamin D supplementation might be beneficial for Hashimoto thyroiditis. Zinc levels should be evaluated for subjects with thyroid enlargement. Other health professionals warn that more is not always better. Consumption of raw, cruciferous vegetables like cabbage, kale, and broccoli should be in moderation, since they contain compounds that may interfere with thyroid function when consumed excessively. Examples of dishes that are good for thyroid health are grilled creamy chicken with asparagus and quinoa salad with salmon and spinach.
So the message there is more is not better. So balance lang.
Alright.
Diba?
Pero mukhang masarap yung food.
Masarap siya.
Hindi naman tayo restricted to eat. Mamaya natin itatanong kay Doc
Yeah,
kung
kay
ano yung
Doc.
mga bawal at pwedeng kainin. Pero Doc, meron kaming question kanina na miss. Yung paano po nagiging cancer ang thyroid problem?
Yes, again, like all cancers, we don't know where it comes from. But we can think of risk factors na lang.
Yes.
Example of risk factors to have thyroid cancer would be a history of radiation in the neck. Maybe they have other treatments, so they have radiation in that certain area, so that's a risk for cancer.
I see.
Also, again, genetics and family history. If
Would
they have a
cause.
family history of cancer, so likely if this patient has a thyroid problem, then he has to be careful with that.
Alright. Now,
Alright.
paano natin malalaman yan? So, what are the diagnostic procedures po of these conditions? So, yun muna pong goiter, hypo,
Yeah.
hyper, and
Yes.
then cancer. Paano po siya nalalaman?
Okay, first, like all in med school, we are taught to have a good medical history and a good physical examination.
Yes.
With that, we can order some laboratory tests. Like for hyperthyroidism, we have to check the hormones. What kind of hormones? There's what we call free T4, free T3. Those are thyroid hormones. And also we can check TSH. That TSH is found in the brain. So we'll try
Kasi
to
doon
check
sila
on that.
nagbabase, Pierre. Doon sa balanse ng levels ng T4, levels ng TSH, they'll determine if it's a hyper or hypo.
I see.
But for example, Doc, a patient has goiter lang. As I've said, bosho is just enlargement of the thyroid. So what should be their choice? What would be the diagnostic choice?
So we can include thyroid ultrasound.
Ultrasound, okay. Alright. So ano po ang pwedeng makita sa ultrasound? For example, ako may anterior neck mass. I went to you, Doc. What should I do? You recommended ultrasound. Ano po ang hahanapin doon?
The size of the thyroid gland.
Okay.
Also, if the thyroid gland has buccal nodules,
Nodules.
and also the vascularity will help
Okay.
also.
So with that initial finding, Doc, you can pinpoint if it's benign or cancerous.
Oh, we're talking about nodules.
Yes, yes.
If for nodules, we can look at it by the description,
Okay.
but still we really can't say if it's cancerous or not. But we can suspect. There's a scoring system. For example, this is they describe it like hypoechoic, or the shadow is too dark or too light. So there's a scoring system. So if you heard sometimes like in the breast, they have some scoring system that by RADS 1, 2, 3. Here also in the thyroid, they also have this
May
scoring
classification.
system
Okay.
from thyroids 1 to thyroids 5.
For common people like us, Doc, no, nakatingin kami sa salamin, may bukol na takot agad.
Yes.
So, ano po ba yung dapat naming makita na dapat na naming ikatakot o hindi naman dapat ikatakot?
Sometimes it's really hard to feel the nodule, especially if it's too small. But if it gets bigger, then it's quite obvious. So I think most of the patients, they don't check their neck, but their friends would realize or found out that, hey, they have a
You have
nodule
something.
coming out, or something's bulging. So they'll be aware that they go to the doctor. And we ask, who noticed it? You? And they will say, no, it's my dad or my friends. They noticed that one.
Tsaka actually, mararamdaman nila yan eh. Yung sinabi mo kanya, dysphagia, hirap lumunok. So there would be some discomfort in terms of swallowing.
Yeah, if it's quite big, yes, they
Yeah,
would
so that
complain
would
of
be a
difficulty
good
swallowing.
cue to go to the doctor, na. Oo.
Alright.
Also, sometimes difficulty of breathing if it's obstructing. Yeah.
Alright. Okay, Doc, may sinasabi din if it's moving or just steady. Meron po bang kinalaman yon? If the nodule is moving when you swallow and then if
Usually,
it's just
because when you swallow, if you can see that nodule already, you can see it moves upon swallowing.
So most probably
So,
thyroid yun.
yes.
Most probably thyroid siya.
Okay.
Regarding dun naman sa hyper and hypo, Doc, the question is, how do we treat this? How do we reverse the symptoms?
Yes. For hyperthyroidism,
Yes.
maybe there are 3 treatments. First would be medications.
Oral medications.
Yes. You give them. It's quite. You have to tell the patient to take it long term. For sure, when you give the medicine, she will feel well already. She'll improve. But still, they have to continue it because sometimes it tends to come back.
I see.
Or if they don't want to take the medications long term, they can have radiation, radioactive iodine ablation. They'll take a tablet which is radioactive to burn the thyroid gland. Burn the thyroid gland.
I see. Okay.
Yes.
Kagaya ng case study natin, she was given radioactive iodine. What is
Kasi
that?
hyper siya.
Okay. Anong ginawa nun, Doc?
It destroyed the thyroid gland, no?
Okay.
And then,
She was hyperthyroid then. She didn't want to take medicine. So she took radioactive iodine, then it burned the thyroid gland. It ablate the thyroid gland. So the thyroid gland is still there, but it's not functioning anymore. It doesn't produce hormones anymore.
Kaya siya naging hypo.
Yes.
And then, ano na yung
treatment for the
hormone?
hypo naman.
Yun. Ano na yung hormone na yun, Doc, na naging...
Yeah, for another treatment for the hyperthyroidism would be surgery. If they don't want radioactive iodine, they can have it removed surgically. So once they are hypothyroid, the treatment would be the opposite. They have to be given thyroid hormones. So we have synthetic thyroid hormones, which we call L-thyroxine. So there are different dosages. So up to the patient, what suits the patient.
And
if we
this,
monitor the patient with their blood exam.
And based din dun po sa case study, itong thyroxine ito will be lifelong na.
Yes, if they don't have a thyroid gland already, like for example, in our case, she received the radioactive iodine, then she will have the L-thyroxine for life.
Okay. What happens, Doc, if you miss the medicine? Yun yung tanong talaga ng mga tao. Pag kunyari, Doc, nakalimutan mo, pwede...
In hyperthyroidism, sometimes they feel well already. As I've said, they should take the medicine. They feel, oh, I'm already well, I'll stop the medication. Not knowing at times it comes back. So if left untreated and hyperthyroid with it, and then something will precipitate it, like for example, they have an infection, just like a pneumonia or even diarrhea, which can exaggerate the release of more thyroid hormones. And we call this thyroid emergency thyroid storm. So that's dangerous, that can lead to death.
So it's life-threatening.
Yes. So for hypothyroidism, for example, in our case, if she didn't take the medication, then
Nalimutan.
yes, then she'll be hypothyroid, she'll get big, her cholesterol will be high, heart will slow down,
her
which
heart.
give her problems.
Metabolism.
She'll be lethargic, and sometimes it can lead to coma.
I
Coma.
see. Alright. So, ang paalala talaga, don't miss your medicine and always see your doctor. Now, Doc, can we prevent the disease? Ano po ba ang role ng iodized salt na meron tayo ngayon para maiwasan yung iodine deficiency?
Yes. Right now, our salt is iodized. We can find it easily. It's cheap. So, it can prevent the simple goiter.
Okay.
But for hyperthyroid or hypothyroid, as mentioned earlier, it's an autoimmune problem. To prevent it, maybe early detection. If they have a family history, maybe they can do an early checkup.
Okay. Doc, meron bang bawal na food or recommended diet that dapat kinakain ng may thyroid problem?
There are some foods with goitrogens. Goitrogens are a compound that are found in food that would interrupt the iodine synthesis. So example would be cabbage, broccoli, your root crops, cassava, and some others.
Kung lagi kang nagka-cabbage salad.
Pero hindi, I think
yes, they have goitrogens that can affect, but if you eat too much, like truckloads of cabbage every day, uncooked, then that can give you thyroid problems.
So
Pag
portion
konti-konti lang.
What we're eating right now, that won't harm naman.
Yeah.
Okay. The root crops kasi is recommended for diet, di ba? So, okay lang.
Compound starches.
Kung kunyari, Doc, yun ang ginagawa mong carb, hindi ba siya masama sa...
It might, yes. Especially if you eat how many, like maybe kilos per day and then daily, then it might, yes.
All right. Now, one last, Doc. Can stress affect our thyroid health?
Stress itself is not good. We have to avoid that, right, and manage it well. So stress can indirectly affect it, but not directly that will cause
Pag lagi kang
hyperthyroidism.
stress, pwede ka
Maybe it can, if you have hyperthyroidism in remission, it can exacerbate
All right.
if you're stressed out.
Okay. Madami pa tayong tanong, Doc, but we have learned a lot again today, Dr. Gan. Dr. Gan, thank you for being with us today. Do you have final thoughts that you'd like to share to our audiences?
Yes. Okay, everyone has a thyroid gland. Then, to know if it's overactive or underactive is by visiting your doctor, having a good checkup, and if blood exam are necessary, then please do so. It's easy to treat, but if left untreated, it might cause problems.
Yes, yawan.
Again, Dr. Michael Gan of Makati Medical Center. A known holistic healing option and more relevant health news when we return. Keep it here on the Billionaire News Channel. Wellness is wealth.
For centuries, acupuncture has been practiced as a natural healing method that seeks to restore balance in the body and promote overall wellness. To help us better understand how acupuncture works, its benefits, and its role in modern healthcare, we are joined by former Health Secretary, Public Health Advocate, and Integrative Medicine practitioner and teacher, Dr. Jaime Galvestan.
Placing needles in strategic points in the body is a healing method as old as time itself. According to traditional Chinese medicine, acupuncture restores the yin and the yang in the body to restore balance and regulate the flow of energy. Former DOH Secretary, traditional health practitioner, and public health expert Dr. Jaime Galvestan explains the core philosophy behind the ancient healing method.
Acupuncture believes that we have good energy and bad energy. We have positive energy, negative energies. And these are flowing always in the body. And then when you're in the negative zone, acupuncture will put it on the positive side.
There is growing evidence that shows acupuncture can support the body's natural ability to heal, rejuvenate, and function optimally. Today, it is increasingly embraced not just for pain relief, but also for managing stress and supporting overall well-being.
The needles are as small as the hair, so it really does not affect all the other organs, and yet it stimulates.
Dr. Galvestan says acupuncture has evolved to address cosmetic issues such as weight management and facial enhancement.
So for example, negative side is your overeating. Then the acupuncture will make you lose weight. Yes. So our appetite suppressing.
The appeal of cosmetic acupuncture is that it is holistic and non-invasive. That's why some women turn to it for self-care and wellness. Clinical studies conducted in 2019 have shown that acupuncture can address simple obesity in Asians by regulating the endocrine system, attenuating oxidative stress, and modulating metabolism in patients with simple obesity. However, this must be combined with a balanced diet and regular exercise. Facial acupuncture, on the other hand, is a natural facelift which can help reduce wrinkles by stimulating collagen production and improving circulation. Dr. Galvestan calls it beauty acupuncture.
Needles, which are painless needles, and these are placed if in the face, small needles or even long, but they are shallow in the face, and it stays there for 20 minutes. I remember a patient from Zamboanga. She comes to me twice a month because she really sees the effect, and every person is noticing.
Acupuncture, he says, can also help promote better sleep.
Then if you're on the mood of not sleeping or insomnia, acupuncture will put you to sleep. So again, the opposites are reversed.
Dr. Galvestan adds that the Philippine Institute for Traditional and Alternative Healthcare, or PITAC, helps regulate and certify licensed acupuncturists to ensure patient safety. While acupuncture is not considered a standalone cure, it continues to be regarded as supportive therapy, which contributes to a more integrative approach to health and wellness.
Here's what's happening. House Majority Leader and Ilocos Norte 1st District Representative Sandro Marcos has filed House Bill 9327, or the proposed Mental Health Voucher Act, seeking to expand access to mental health services for low and middle income Filipinos through a government-subsidized voucher system. The bill proposes the creation of a mental health voucher system under PhilHealth, which would provide qualified beneficiaries with non-transferable vouchers for psychiatric consultations, therapy sessions, medications, and other mental health services from accredited providers. Under the proposal, the voucher system would include tiered benefit packages covering early-stage intervention, moderate condition, and severe or chronic mental health cases. The basic package would include multiple psychiatric consultations, therapy sessions, and monthly medication subsidies. Naganap ang isang bilateral meeting at signing of Memorandum of Understanding sa pagitan ng Pilipinas at Singapore para mapagtibay ang collaboration ng dalawang bansa pagdating sa primary care health promotion, healthcare human resource development, health infrastructure and planning, health regulation and security, population health, digital health, and health financing. Naging sentro din ang kasunduan ng isang innovating training model kung saan maaring kumuha ng masteral degree sa Singapore ang Filipino healthcare professionals na mag-aangat ng kanilang kaalaman para makatulong naman sa healthcare system ng Pilipinas sa kanilang pagbabalik bansa. Pinuri ni DOH Secretary Ted Herbosa ang Ministry of Health ng Singapore para sa kanilang mechanisms in responding to emerging and infectious diseases na gaya ng hantavirus. Nagpasalamat naman si Singapore Health Minister Ong Ye Kung sa Pilipinas dahil sa malaking ambag ng Filipino health workers na nasa Singapore sa paglago ng kanilang healthcare system. Napag-usapan din ng dalawang bansa ang mga potential areas of cooperation para sa tuluyang pagbaban ng vaping sa ASEAN member states. Nagkita at nagkausap ang Health Minister ng the Netherlands na si Sophie Hermans at DOH Secretary Ted Herbosa sa 79th World Health Assembly sa Geneva, Switzerland. Siniguro ang kooperasyon ng dalawang bansa para maalagaan ang 38 Filipino crew members ng cruise ship MV Hondius kung saan nagkaroon ng hantavirus outbreak. Sa the Netherlands, isinasagawa ang 6 weeks quarantine ng Filipino crew. Nagpulong din sa Geneva ang WHO Western Pacific Region Group, sentro ng usapan ang Ebola virus na itinuring na ngayong public health emergency of international concern dahil sa paglaganap nito sa bansang Congo at Uganda. Ayon kay Herbosa, may itinakda ng protocol sa Pilipinas na ka-heighten ang surveillance system ng epidemiology at quarantine bureaus para sa mga kababayang manggagaling sa mga bansang apektado.
The thyroid doesn't just do one thing. It is the master conductor of our body's rhythm. When it works perfectly, you don't even notice it, but it runs too fast or too slow, the entire factory goes into chaos.
We had another wonderful discussion today, and we would like to see you all again next week here in our show where we value your total well-being. Live well, live wealthy, wellness is wealth.